Well, Dr. Pakman, let me ask you, why is it that when most of the time a person has a root canal, that then he also needs a crown or a cap, as you call it? When yet, like with a missing tooth, there are a whole bunch of people running around, they didn't have a cap on it for years. And again, nothing bad happened.
Right. Well, basically what you're doing is you're rolling the dice after having a root canal. Root canal teeth, because they don't have the nerve left in it, because the endodontist removes the nerve of the tooth and then fills the space of the canal with an inert material. I'll digress for a minute and tell you a little bit about what the nerve of a tooth is. Not only is it a nerve that senses things and feels things, it's also a blood supply for the tooth as well as a lymphatic organ. So it's really three different things in one. Once you've removed it, the tooth still remains in the bone and the gum, but it loses its natural hydration system, so they become brittle. And root canal teeth are very highly susceptible to fracture. That's why we generally crown them. That's basically what it is.
So only because it doesn't fracture within maybe a few months or a couple of years doesn't mean it couldn't fracture down the road.
You could get lucky. You could get lucky. But especially the molar teeth, because there's so much functioning done on them with chewing, they really should be protected with a crown.
And if it does fracture, what usually needs to be happened then? And does it fracture usually like nicely above the gum lines or below the? Is it then a difficult operation to get out of it, or is it? What needs to be done after it fractures, if it fractures?
Well, right. If it fractures above the gum, one of the pointed parts, which we call the cusp, comes off. It's very easily restored with a crown. The problem becomes if the tooth fractures below the gum line and gets below what we call the height or the crest of the bone. Then you're looking at bone or gum surgery to expose more of the tooth and then put a crown on it. Sometimes it's not possible. Sometimes a root will split down the root itself, and then it has to be extracted. Yeah.
And that means a hole, and then now we go back to needing an implant and or a bridge.
Right.
So we add on a few grand.
Exactly. Becomes more expensive.
One vacation gone.
Right.
That doesn't sound good. Well, all right.
Yeah.
I think that that seems to be explaining that, and I guess again, people watching that hopefully realize that when their dentist, whoever that might be, tells them you do need that. You see, sometimes we start coming into an age where, yes, we all are salespeople, we all try to make money, and we become a little too cynical, and we stopped, in my opinion, a little bit too much looking at the doctor as somebody who wants to make money, which he does, and he's entitled to. Why would anybody do such a valuable service and then not get paid? But the truth is, working with dentists and with other doctors since 20 years now, they believe in what they do. They may have slightly different treatment plans here and there, but they believe in what they do. And it, on an average, behooves us patients, I have noticed, to follow the recommendation and work towards it. It may not always be possible right now, but come up with the doctor's best alternative, and then always try to work on getting where he wants you to get eventually.
Right.
Yeah. So I hope that helps for the people watching, and we'll have more interviews with Dr. Pakman.